Animal Farm was written by George Orwell in 1945. It's not just a children's story about pigs and chickens. It's actually a really sharp political allegory. It's one of my favorite books. It's about power control, inequality, corruption, and how the system can betray the very people that they claim to serve, right? And on the surface, remember the animals rebel against the human farmer and they form their own society based on equality, right? But over time, the equality unravels, right? In Animal Farm, the pigs take over, they rewrite the rules, they silence the dissent, and they convince everyone that they're still free, right? And in George Orwell's point was kind of chilling that even revolutions built on justice can become machines of oppression. And if you don't watch the wall where the rules are written. Remember the very famous quote, right? From Animal Farm is all animals are equal, but some are more equal than others. And that's something that can even apply to wounds. And so that's where we're going to dive in today. So, welcome back to Diabetic Foot Files with me, Dr. G. So, why does this matter when it comes to wound care? Now, imagine this isn't just a story when it comes to Animal Farm. This isn't about animal, but imagine the farm is the hospital or clinic or a healthcare system, and animals are like we're the patients or chronic wounds. And think about the administrators, the people who write the rules, the insurances, the policies, and even the protocols that are supposed to help. Okay. And we may start off as saying all wounds are equal, but then it becomes all wounds are equal, but some are more equal than others. In other terms, it's like, some are more profitable than others because you have to wonder why some people are there's majority of people getting amputated in certain areas and not. And just like that, you see patients who will present later, you see underserved neighborhoods, places that have fewer resources and like nobody speaking up loudly to help these underserved communities. And they are quietly sacrificed. And it's not about being a bad physician or anything like that or clinician, but it's about how possibly the healthcare can be rewarding amputation over prevention. And that's the whole point of being able to salvage and wound care because, wound care, tell people, wound care requires endurance. Just like somebody who's a marathon runner, wound care is endurance. You have to have the endurance. And one thing I've learned is in life, even though people judge, nothing in life I've noticed in people behaviors is compartmentalized, I should say. I've never seen somebody who is lazy in one area and a hard worker in another area. I've never seen that in my life. So I feel like when you do wound care, you have to be somebody who, not just a hard worker, somebody who has endurance. You're going to have endurance in every other aspect of your life. And if you're so quick to amputate, that's not endurance. Wound care is endurance. You have to do it week after week, frequency like 3 times a week, 2 times a week. But you can't stop when it comes to wound care and limb salvage. Okay. So in the movie Animal Farm, remember Animal Farm they had 7 commandments about equality on the barnyard. Remember the pigs wrote the commandments. And remember, they slowly amended them with time. So remember, with Animal Farm, they were like, no animal shall sleep in a bed. And then it later became, no animal shall sleep in a bed with sheep. Then they were like, no animal shall kill another animal. And then they amended it to no animal shall kill another animal without cause. And finally, the one quote that I loved is all animals are equal. And then it became, and they amended it that all animals are equal, but some are more equal than others. And in wound care, that's the same thing. Original commandment in wound care, I mean, my first wound care commandment would be vascular, but I'm just saying original wound care commandment is all wounds deserve treatment. All wounds deserve treatment, but it has slowly become like saying, "Oh, the patient is too high risk. There's nothing we can do. The patient didn't follow instructions. Amputation is less safer for this patient." Things like that. But is it safer or is it cheaper? Or do you not know how to do wound care? Do you not have a good referral system? Are you trying to cover up something? Things like that. But let's do our own seven commandments of wound care. Like I said, my first commandment is contact vascular. Okay? Make sure the patient has blood flow. Then I think it's going to be more than seven commandments. Then two, anything that delays care is not helpful to the patient. Three, anything that promotes healing is an ally to the patient. Four, no wound shall be treated for appearance over function. Five, no wound shall rest on pressure. So you already know offloading is key. That should be like under number two. Six, no infection shall be ignored. Seven, no limb shall be amputated without exhausting all options of limb salvage, in my opinion. Okay. And all wounds are equal and all limbs are worth saving. That's my thing. Okay. So in animal form, remember Napoleon, he's the pig, he's the dictator. And the wound care equivalent of that, the dictator, the person who makes the rules, the resources, the profit, and all that stuff is the healthcare system, which I still love the healthcare system, because I work in it. Remember Snowball? He was the idealistic pig who promoted progress. And what is the wound care equivalent of that is pretty much like evidence-based preventative medicine, early intervention, and limb salvage. Next is Boxer. Remember Boxer? He was the loyal worker who discarded when he was injured, unfortunately. And so that's like the working class diabetic patient who gets amputated without even just giving the chance of limb salvage. Next are the dogs in Animal Farm. Animal Farm, the dogs, remember the dogs were Napoleon's enforcer. And the enforcers in the wound care are the people like the lawyers, the lawsuits, the admins, you know, people who silence those people. And then the sheep, those are remember the sheep were the slogan chanters, right? They were chanting the slogans. And nothing's wrong with that, but you can't just follow protocol without equality, equity, or context, okay? Then there was Clover. Clover was kind but a powerless observer. So these are like people who see the disparity in the healthcare system, but can't say anything about it and can't help stop it, which I understand, but you have to speak up, and that's the whole point of diabetic foot files is for patients to advocate for themselves and be educated to help save their limbs. Okay, that's the whole point. Ask the right question, and then Benjamin, even though he was a cynical, burnt out donkey, we have burnt out providers, okay, who won't stop fighting for their patients. Like I said, wound care is an endurance thing. It's a marathon. And then the commandments in wound care are our standard of care that shifts but helps serve the patient, but also it serves the system as well. So we have to think about that. And what is the real world outcome of this? In the real life, it's not available animal farm. Here's what really happens. And I remember I had a black patient, this African American patient, when I think I was doing a preceptorship, and he just every appointment he carried this paper that was an article, and this is back in what 2000 and maybe 2016 or 17. And this patient, his wife was getting treatment for a diabetic ulcer. And every time he bought this newspaper that talked about the health disparities of the higher risk of amputations with people of color compared to white patients. So fact of the matter is like black patients with diabetes are up to three times more likely to be amputated compared to white patients. And only 25% of patients who undergo a major amputation had an actual vascular evaluation beforehand. That's horrible. And then the number one predictor of amputation, right, is actually not infection and not ischemia, which is poor circulation, is actually the zip code. where the patient lives. Okay. Isn't that interesting? And so, we don't want to look like it to look like there are villains, but you have to look at the policies, you have to look at forms, you have to look at delayed consultations. And but you have to see what is effective. So let's do a quick case so everybody understands about all these health disparities that are going on when it comes to diabetic foot ulcers. So let's do Boxer. Let's say Boxer is a 52-year-old Black male who's a mechanic. He steps on something, right? And he doesn't feel it. So when he goes to the doctor, they say, oh, it's just a blister. And they say, come back next week. Just watch it and keep it clean. He doesn't miss the appointment, but the system missed the diagnosis. So when the patient returns, it's osteomyelitis now. Still did not have a vascular study, still no offloading. So by week 5, the infection spreads. By week 6, the patient's on the OR table. And what do they use the diagnosis as? The complications of diabetes. But the truth of the matter is this patient leg was amputated because they didn't have anybody to advocate. They were told to just watch and see instead of actually treating it with actual clinical judgment and knowing that the patient is at high risk of infection despite anything. Don't ever say it's, oh, it's just a blister. It's not just a blister, okay? Now, next one, let's say Clover. Clover sees what we don't, okay? So Clover is a daughter. She comes to every appointment. She asks questions. I always love when patients, family members ask questions. And she noticed that her mother's friend, who is Caucasian, got and was more affluent, got a MRI faster. And then she noticed that the wound care nurse changed without warning. So Clover represents like a patient's caregiver. And, the patient's daughter sees the inequality but doesn't say anything about it. So, remember the rules. Next is the sheep and dogs. Okay, so remember the sheep, they shan't, right? They can't like follow the guidelines, follow the standard care. Offloading was in order. And they may mean well, but it gets drowned out, you know? And so the fear of lawsuits, the fear of calling vascular, which should never be a fear. You should always call vascular and the fear of making noise. People are very afraid to speak up for their patient sometimes because they're afraid to get silent. And what ends up happening sometimes with the patient, another below the knee amputation, unfortunately. And, we always say prevention is better than cure, right? Because that's what community clinics are for. That's why there were created limb salvage teams. That's why there's screenings for loss of protective sensation and peripheral arterial disease. That's why there's offloading routine. It's not about the profit, right? But it's about how to prevent the ulcers in the first place. So, what is the justifications of missing these patients, and the patients end up with a lower below-the-knee amputation, which is far below that. That's our goal, not to have any amputations at all. People may justify that by saying, yeah, the patient's high risk, the patient waited too long for limb salvage, the patient missed follow-ups, the patient didn't have insurance, amputation was safer than debridement. That is not true. Okay? That you have to try your best to save the patient's limb and the patient's life at the same time. That's the whole point of being a physician, right? We're supposed to do not just the impossible, but it is possible. And that's the whole point. Like, we're supposed to do things that are beyond what normal anybody can just wrap their head about that doesn't have the training, okay? You want somebody who can perform miracles. And we're not talking about like, oh, just, make them walk in when they're paralyzed or anything, but that's what doctors do. They research, they do the impossible, and they, defy even what is known as modern science because you're able to provide the patient things that are pretty much outside the norm, beside beyond the borders or the boundaries of standard of care to help with limb salvage. I once heard a doctor say, when you see a wound, hesitate and don't amputate. He's saying, like, don't just amputate immediately. See what else you can do. Okay, we're not saying put the patient in a life threatening situation, but we're saying what else can be done. Is there anything else that can be done besides amputate? Okay. So they may say like all wounds are equal, but are all wounds are equal? Pretty much not. Some patients are more complex than other, but I believe all limbs are worth saving. And you know what? Despite of anything, when it comes to climate compliance, there is something called efficiency, okay? And there is something called abandonment. So, we shouldn't abandon any of our patients no matter what. That's why I'm very aggressive when it comes to following up with my patients, making sure because time is tissue. So if the patient doesn't follow up, yeah, you follow up with the patient. Make sure, see what's going on because something may happen. I even remember, even when it comes to healthcare policy, I I think I've told this story before. Had this patient, he was new, he just got discharged, he had a heel ulcer, and I wanted MRI. I ordered an X-ray and then I wanted MRI, and he went to go get both. And I didn't hear from him for like within a day or two because I was just following up. And then I got a notification that they denied my patient's MRI, so I had to do a peer to peer. And then I finally got the X-ray. They finally sent me the X-ray because I guess he got it done, like, maybe a little bit late. Maybe he's waiting for approval, I'm not sure. But the I'm, like, literally on the phone with the peer-to-peer. I just got the X-ray, and I'm like, "That is gas." And I sent it to the person, and I'm like, "There's gas on the patient." And they're like, "Oh, well, now it's approved." I'm like, we don't need the MRI. He needs to go to the hospital right away. There's gas in his foot. We can see the gas through the X-ray now. So, yeah, you denied a MRI for a patient so we could see how bad this heel ulcer was, but it had gas in it. And now you approved it now, and we don't even need approval because the patient's headed to the hospital in the ER immediately because he needs the removal of that gas in his foot. Okay. And I remember that patient coming back to me a whole year later. And I honestly didn't recognize him until he told me about it because he looked so much healthier and he wasn't in a wheelchair anymore and he was walking again. And I was just like, "Oh my gosh, that's you." And he was like, "Oh, you helped save my life." Because I what happened was and I don't care if anybody judge me. What happened was when I saw that gas, I called him immediately, and he was not picking up. And I was calling from the office phone at work when I was practicing, and I guess he just didn't wanna pick up from the office, and then so I said, "If he's not picking up," and I called like 5 times, I said, "Maybe he just doesn't like that I'm calling from the office, like, maybe he thinks we're asking him about a bill or something." So I called from my cell phone, he picked up, and I was just like, "Sir, there's gas in your foot. You need to go to the ER immediately." And he was like confused what I was talking about. I said, "Yes, there is gas in your foot. Like, this is what's going on. This is a very serious infection. You have to go to the ER immediately, like right now. Tell them that you have gas in your foot. Okay. Tell them take the x ray. You have gas in your foot. Okay." And he remembers me from doing that. And he said it saved his life because, like, literally, they had to do an operation. He had to be in ICU everything. So I'm very happy about that, but literally a lot of it was delayed because of coverage, and then also the fact, like, I guess they had to wait for it, like, I don't know. Like, it was something about the insurance not fully covering it, but he was waiting for that. But long story short, we should treat every limb like it belongs to our mother or somebody who we care about, okay? I'm not saying question the system, but I'm saying question, is there anything else that can be done? Okay? Like, choose salvage when it comes to amputation. Okay? Choose salvage over amputation. Okay? See if there's anything else that you can do. Like I said, one thing I've learned the most from limb salvage, the patients who have kept their limbs are the patients who advocated for themselves. It wasn't because somebody else, like a doctor, advocated for them. They advocated for themselves. They were so stubborn. They were like, "No, you're not amputating my foot." Sometimes it worked out for them, sometimes it didn't. But the patients that I was able to see, and thank God they were able to still have their life and didn't get septic or something like that. They said, "No, do not amputate my foot." And they came out of the hospital and they just researched and looked for somebody who possibly could help heal their foot or wound. And I appreciate those patients, okay? So this story is not just about wounds, okay? It's about what happens when we treat wounds, if we treat a wound as a less urgent, if we treat some patients as they were saying, oh, saying the patient is difficult, and treating some wounds like they're less worth saving. I mean, that's pretty much medical gaslighting, systemic bias, and using amputation as a shortcut and causing delays. Okay. So everybody knows, like I said, when it comes to wound care, prevention is better than cure. It's about screening early. It's about offloading aggressively. It's about demanding vascular studies. It's about educating your patients even before an ulcer forms. Remember 60-second rule, check your feet, and saving the limb when the system says just cut it off, right? We don't want that. Just cut it off. See what else you can do. Sometimes when I hear "just cut it off," I'm like, obviously you don't know how to do wound care then. You obviously just don't know how to do wound care sometimes. Not all the time, but when I hear somebody just wants to cut off a limb of a simple wound that can be healed, there's so many resources to heal a wound. Yeah, you obviously just don't want to do wound care. Okay? In my opinion, okay? Sorry if it hurts. But Animal Farm isn't just about animals. I mean, I guess I'm gonna name this episode Wound Farm, okay? Because it's not about wounds, it's about what happens to a wound when the system rewrites the care for the wounds and the patient pays with their limbs, okay? So at the center of Wound Farm is a wall, and the wall are words, okay? And like I said, the wall right now reads, all wounds are equal, but they try to say some wounds are more equal than other, and we're trying to disprove that and say all wounds are equal and we should all treat wounds and make sure we can salvage them. So when it comes to your care, make sure you can prove it because you know what? In wound care, we're healers. And that's the whole goal of it. So this is Diabetic Foot Files. I don't know why I picked this topic, but I love Animal Farm, and I for some reason my brain was seeing the correlation. And the whole point of diabetic foot files is limb salvage. So this is Dr. G with Diabetic Foot Files. Take care of your feet because they take care of you.